On Wednesday this week, President Yoweri Museveni made an address regarding the country's COVID-19 situation. In his address, President Museveni intimated that the measures that had been enacted to control the pandemic were paying off, but emphasis needed to be placed on vaccinating the population. Now, the Ministry of Health intends to ramp up the country's vaccination program by carrying out an accelerated vaccination campaign in the Kampala metropolitan area.
The Ministry of Health is working with partners and the leadership of Kampala City Authority, Wakiso and Mukono districts to conduct a one-week accelerated vaccination campaign against COVID-19.
To this effect, 2,976,403 doses of Pfizer, Moderna, AstraZeneca and Sinovac vaccines have been provided for this exercise and will be dispatched to the special 58 vaccination centers that will be created.
The focus of the vaccination program is to vaccinate, as you all know, the most vulnerable, the 4.8 million persons of the priority group, as you all know.
With the exercise concluded in the Kampala metropolitan area, it will be rolled out countrywide. In the meantime, resident district commissioners and resident city commissioners are also drawing up plans to help ramp up vaccination in their areas of jurisdiction, following the president's directive. This follows the president's instructions to these officials to ensure that vaccines dispatched to their areas do not go to waste. Anderson Burora, the RCC of Rubaga Division, says they intend to extend the vaccination services to people's places of work.
That the area areas of vaccination, like Mengo Hospital, Rubaga Hospital, most people have been there, most especially those who are in the neighborhood. But those who are at places of work have found it a little bit hard for them to go to vaccination points.
However, he is concerned that baseless claims by politicians that the vaccines are already expired will derail these efforts. In Kabarole district, RDC Sarah Ayesige says they'll first carry out communal testing to determine the actual number of COVID-19 cases. This will be followed by a massive vaccination sensitization campaign.
It is a total lie when people say that we no longer have COVID in Uganda. For example, in Kabarole we have families, for example, in Liantonde in Rutete sub-county, we have 2 families that are having 14 cases of COVID-19.
In Padel district, RDC Disman Oke says they are withdrawing the vaccines from the Health Center 3 to the Padel Health Center 4, where demand is higher, in addition to carrying out a sensitization campaign.
Our Health Center 4 in Padule is what we have as the main referral hospital for our district. And everybody who wants vaccination always accesses that place.
Government hopes to deliver 12 million doses of vaccines into the country to meet its target of vaccinating 22 million people. Currently, 1,807,767 people have received their first and second doses of the vaccines. Joyce Nakato, NTV Weekend Edition.